The coronavirus that can set you back with a common cold typically infects just the nose, sinuses and throat. But it's more common for the one responsible for COVID-19 to spread into the cells of the airways and lungs as well. Clinical progression of the illness appears similar to SARS. Patients develop pneumonia around the end of the first week to the beginning of the second week of illness. The body's efforts to fight the virus can cause inflammation in the lungs. It is this kind of inflammation and destruction that is called pneumonia. The coronavirus also has the ability to latch onto, hijack and destroy cells of the kidneys. If the disease progresses, organs can start failing. This could be the result of the virus's direct attack, as with the lungs and kidneys, or because of septic shock. Septic shock is a body-wide response in which the immune system is trying to attack the virus everywhere. Unfortunately, the inflammation caused by the immune system damages human cells throughout the body. The ways in which people die from COVID-19 are actually quite similar to the way people can die from the flu, even though influenza viruses are very different from coronaviruses. The 1918 Spanish flu, which had a 2.5% fatality rate, eerily close to what's estimated for the coronavirus. By comparison, the figure for the seasonal flu is roughly 1.3. The reproduction number for the flu of 1918 was about the same as that of the new coronavirus, perhaps higher, but that was before modern treatments and vaccines were available. CDC calls Spanish flu the deadliest pandemic flu virus in human history because it infected roughly one-third of the world's population and killed an estimated 50 million people worldwide. Spanish flu was deadly to young and old, while coronavirus has proven to be most lethal to the elderly and left young people relatively unscathed. Professor Nirmal Kumar, consultant otolaryngologist and head and neck surgeon, said the nose was main entry point for the virus when we breathe in droplets infected with coronavirus. He said, in young patients, they do not have any significant symptoms such as the cough and fever, but they may have just the loss of sense of smell and taste, which suggests that these viruses are lodging in the nose. 80% of people have such minor symptoms, they don't actually require any medical care at all. The 20% who do feel quite ill need to be evaluated, and some of them will require hospitalization, and some of them will require intensive care. In about 14% of cases, the virus causes severe diseases including pneumonia and shortness of breath. And about 5% of patients have critical diseases including respiratory failure, septic shock and multiple organ failure. In 2% of reported cases, the virus is fatal, and the risk of death increases the older you are. Those most at risk for severe symptoms include senior citizens and/or people with underlying medical conditions, such as cardiovascular or lung disease, cancer or diabetes. Children seem to be at less risk of suffering noticeable symptoms of the disease. Children can be infected and can spread COVID-19 to others, including adults, for several days before they show symptoms. Symptoms in children are typically mild but can pose life-threatening risks to more vulnerable populations. The World Health Organization says mild cases last about 2 weeks, while most patients with serious illness recover in about 3 to 6 weeks. Now researchers in Hong Kong have said that recovered coronavirus patients can be left with damaged lungs. A small study of 12 patients discharged from hospital showed that 2 or 3 had reduced lung function. However, it is too early to confirm any long-term effects. In some patients, lung function could decline by about 20 to 30% after recovery, says Dr. Owen Sangtakian, medical director of the Infectious Diseases Center at Princess Margaret Hospital in Hong Kong. Computer tomography have shown fluid or debris-filled sacs in the lungs, which may get progressively worse as the illness develops. The findings from Hong Kong confirm very early investigations from Wuhan in early February 2020. In a recent study, scientists from Zhongnam Hospital of Wuhan University analyzed 140 lung scans of COVID-19 patients and found a ground glass opacity in both lungs of each patient. Compared to the coronavirus, Ebola was less contagious and transmitted mainly by bodily fluids. The coronavirus can be transmitted in coughed and sneezed respiratory droplets that linger on surfaces. And yet Ebola infected more than 28,000 people and caused more than 11,000 deaths. Ebola is more lethal, and shortages of staff and supplies, poverty, delays by leaders and distrust of government exacerbated the outbreak. When severe acute respiratory syndrome, SARS, hit Asia in 2002, it was pretty scary, but within months, SARS was brought under control and for the most part stamped out by international cooperation and strict old-school public health measures such as isolation, quarantine and contact tracing. This would be an ideal outcome. But the difference is that SARS had more severe symptoms than the current coronavirus, so people went to the hospital shortly after being infected. Experts warn the outbreak in the United States and other countries is more widespread than tracked because many people with mild symptoms don't know they have been infected. The British Association of Otorhinolaryngology and UK say asymptomatic patients, ones who do not have a fever or a cough, could show a loss of smell or taste as symptoms after contracting coronavirus. If efforts to contain an outbreak fail, public health authorities will focus on mitigation, dealing with the disease and trying to minimize the harm it does to people and communities. It's a worrisome situation in China, Dr. Nancy Messonnier, director of the National Center for Immunization and Respiratory Diseases, said in an interview on Wednesday, January 29, 2020. It seems like more of a mitigation strategy than a control strategy that China has moved to. This is in essence what happened with the 2009 H1N1 outbreak, also called swine flu. That spread quickly, eventually to an estimated 11 to 21% of the global population. The WHO declared it a pandemic, and there was widespread fear. H1N1 turned out to be milder than initially feared, causing little more than runny noses and coughs in most people. And H1N1 is now so commonplace, it's simply seen as a part of the seasonal flus that come and go every year around the globe. Ultimately, how many people die of coronavirus depends on how widely it spreads, how prepared we are, and what the virus's true fatality rate turns out to be. In the immediate future, antiviral drugs may help, and labs around the world are testing their effectiveness against the coronavirus. No one knows if the coronavirus will be affected by seasons like the flu, despite President Trump's claims that it could go away in April with warmer temperatures. We still need to take strong precautions, Dr. Bakari said. Warmer temperatures may make this virus less effective, but less effective transmission does not mean that there is no transmission. Warmer temperatures might make it harder for the coronavirus to survive in the air or on surfaces for long periods of time, but it could still be contagious for hours, if not days, Dr. Bakari said. The coronavirus outbreak hit amid flu season in the northern hemisphere, and even doctors can struggle to distinguish between the two. The overlap in symptoms probably contributed to slow detection of community infections in some countries. It's likely mixed in the cold and flu season all over the place, in multiple countries, and gone unnoticed until someone gets severely ill. These milder symptoms are good news in terms of not as many people dying, said McKay, of Australia. But it's really bad news if you are trying to stop a pandemic, he added. Even seasonal viruses like influenza and the viruses that cause the common cold don't completely disappear during summer. They are still present at low levels in many people's bodies and in other parts of the world, biding their time until conditions are suitable for infections to spread again. The emerging consensus among epidemiologists is that the most likely outcome of this outbreak is a new seasonal disease, a fifth endemic coronavirus. With the other four, people are not known to develop long-lasting immunity. If this one follows suit, and if the disease continues to be as severe as it is now, cold and flu season could become cold and flu and COVID-19 season. India reported its first case of the new coronavirus on Thursday, January 30, 2020, saying a woman in the southern state of Kerala had tested positive. The patient was an Indian student of Wuhan University in China, India's government said in a statement. The World Health Organization declared the outbreak sparked by coronavirus in China as a global emergency on Thursday, January 30, 2020, after the number of cases spiked more than tenfold in a week, while the death toll rose to 213. Tedros praised China's response in a news conference in Geneva on Thursday evening, but said the WHO was declaring a global health emergency because it was concerned about the virus spreading to countries that did not have the resources to deal with it. In the wake of numerous airlines canceling flights to China and several businesses have temporarily closed hundreds of shops, Tedros said WHO was not recommending limiting travel or trade to China. Nonetheless, foreign governments have been flying home their citizens from Hubei and holding them in quarantine, while airlines including Air France, American Airlines and British Airways have stopped flying to mainland China. Airlines are facing mounting pressure by cabin crew to stop all flights due to unease about exposure to the virus. Meanwhile, Russia announced it was closing its 2,600-mile border with China, joining Mongolia and North Korea in barring crossings to guard against a new viral outbreak. Italy announced its first confirmed cases in 2 Chinese tourists. Italian Prime Minister Giuseppe Conte said the government had decided to close all air traffic between Italy and China, a more drastic measure than most countries have undertaken. 2 members of the same family in the UK have tested positive for the Wuhan coronavirus, England's chief medical officer has confirmed. Cases in the UK had long been expected. The virus has already spread to 18 other countries outside China. Russia has reported its first 2 cases of coronavirus, saying the infected patients were Chinese nationals who had now been isolated. Russia's Deputy Prime Minister Tatyana Galikova said the patients are in the Zabakalsky region, which borders China, and in the Tyumen region, which borders Kazakhstan. Galikova told reporters that all direct flights to China from Russia would be halted from 2100 hours GMT on Friday, January 31, 2020. Thailand has confirmed its first human-to-human transmission of the coronavirus inside the country, a health official said. The patient is a Thai taxi driver, said Tanarak Pipit, Deputy Director General of the Department of Disease Control. The Thai person who got infected does not have the record of traveling to China, and it is likely that he was infected from a sick traveler from China, Tanarak said. Mongolia will close all ports of entry from and into China until March 2, 2020, the government said. It will give its citizens currently in China until February 6, 2020 to return home, though non-Chinese foreign nationals traveling to Mongolia will not be able to do so via China. Japanese Minister of Health Katsunobu Kato said that the government was considering moving up the date, without elaborating. The government classified the virus as a designated infectious disease on Tuesday, January 28, 2020, a move that allows compulsory hospitalization, stricter screening of people entering the country, and the use of public funds for treatment, among other measures. China has the confidence and capability to win the war against a new coronavirus, said the country's foreign ministry spokeswoman, in responding to WHO's decision to declare the virus outbreak in China as a global emergency. On February 1, 2020, the number of coronavirus cases worldwide has surpassed that of the SARS epidemic, which spread to more than 24 countries in 2003. There were around 8,100 cases of SARS severe acute respiratory syndrome reported during the 8-month outbreak. But nearly 10,000 people have been infected with the new coronavirus, most in China, since it emerged in December. More than 100 cases have been reported outside China, in 22 countries. But economists have said the new coronavirus could have an even bigger impact on the world economy. It has forced global companies including tech giants, car makers and retailers to shut down temporarily in China. The speed and scale of the country's response to this new virus is widely considered to be unprecedented. The difference is the way the virus behaves inside the human body. SARS was a brutal infection that you couldn't miss. Patients were contagious only when they had symptoms. This made it relatively easy to isolate the sick and quarantine anyone who might have been exposed. But the new virus, 2019 CoV, is harder to spot and therefore harder to stop. There is a tendency to focus only on how deadly a virus is. But it is this, in combination with a virus's ability to spread, that determines its true threat. If effective controls aren't put into place, COVID-19 could ultimately infect between 40% and 70% of the population worldwide in the coming year, according to Harvard T.H. Chan School of Public Health epidemiologist Mark Lipsitch. When current estimates for COVID-19 are compared to the 1918 pandemic, they are eerily similar. The outcomes will likely be different given modern medicine, however, the impact on society and its functioning is likely to be significant. Many of the vaccine and drug development efforts underway build on past efforts to deal with other viral outbreaks, including coronaviruses like MERS and SARS, which means researchers had a head start with COVID-19. Even with recent advancements in medical technology, it is unlikely a vaccine could be available for mass distribution within a year. This means that public health measures to contain the spread will be crucial to contain the outbreak. Most of those cases would be mild, and some people might show no symptoms at all. But the prospect of being infected with a new virus can be frightening. The symptoms to look out for, according to the Centers for Disease Control and Prevention, CDC, are fever, coughing and shortness of breath. These symptoms usually appear between 2 days and 2 weeks of exposure to the virus. A confirmed case in Tibet means the virus has now reached every region in mainland China. The virus is affecting China's economy, the world's second largest, with a growing number of countries advising their citizens to avoid all non-essential travel to the country. In the U.S., Chicago health officials reported the first U.S. case of human-to-human transmission. The new patient is the husband of the Chicago woman who brought the infection back from Wuhan, China, the epicenter of the outbreak, CDC and Illinois health officials said during a press briefing. The central Chinese province of Hubei has been the site of almost 60% of infections, as well as more than 95% of deaths. But 2 of its cities, Yuangang and Xiaogan, with combined populations of more than 12 million, have racked up more than 11% of global infections and deaths. The province of Hubei, the center of the epidemic, remains under virtual quarantine, with roads sealed off and public transport shut down, but small numbers of travelers continue to breach the lockdown. Nearly 10,000 flights have been suspended since the outbreak of the coronavirus in China, according to travel and data analytics firm Cerium. Many nations have put on special charter flights to repatriate citizens from China. Cities across China have continued to implement special measures aimed at curbing the spread of the pathogen. Tianjin, a city in northern China with around 15 million people, said all schools and businesses would be suspended until further notice. Villages and cities in China have resorted to flying drones with speakers to patrol streets and scold people not wearing masks in public amid the coronavirus outbreak, according to Chinese state media. Global Times reported that local officials had been putting up slogans in an effort to get communities to stay at home during the epidemic and to avoid people gathering together to slow and prevent the spread of the coronavirus. A video clip posted on the microblogging website Weibo showed people playing mahjong in a village near the city of Chengdu, being spotted by a camera mounted on a patrolling drone. Playing mahjong outside is banned during the epidemic. An official tells the villagers through a loudspeaker. "You have been spotted." Qatar Airways is the latest airline to suspend flights to China over the coronavirus outbreak. The carrier said it will unfortunately stop flying to China on Monday, February 3, 2020, due to significant operational challenges caused by entry restrictions imposed by several countries. Countries around the world have closed their borders to arrivals from China as officials work to control the rapid spread of the coronavirus. The US and Australia said they would deny entry to all foreign visitors who had recently been in China, where the virus first emerged in December. Earlier, countries including Russia, Japan, Pakistan and Italy announced similar travel restrictions. Other countries including New Zealand, Russia, Japan, Pakistan, Italy, Indonesia and Singapore have also announced travel restrictions. But global health officials have advised against such measures. The WHO recommends introducing screening at official border crossings. It has warned that closing borders could accelerate the spread of the virus, with travelers entering countries unofficially. In the US, citizens and residents returning from Hubei will be quarantined for 14 days. Those returning from other parts of China will be allowed to monitor their own condition for a similar period. The Philippines on Sunday, February 2, 2020, reported the first overseas death from the growing epidemic of a coronavirus that originated in China, where new confirmed infections jumped by a daily record to top 14,000 cases. It was the first death reported out of more than 130 cases in around 24 other countries and regions outside of mainland China. China is facing mounting isolation as other countries introduce travel curbs, airlines suspend flights, and governments evacuate their citizens and other countries, declaring that Chinese passport holders will be denied entry for the time being, risking worsening a slowdown in the world's second-largest economy. Genetic traces of the coronavirus were found in the feces of some patients, said the health authority of Shenzhen, one of the most populous cities in China. A new hospital in the city will start admitting coronavirus patients from Monday, February 3, 2020, state media report. The Huishenshan Hospital, which has 1,000 beds and was built in just 8 days, is one of 2 dedicated facilities that are being constructed to help tackle the outbreak. A second hospital with 1,600 beds is due to be operational later this week. The mayor of Huanggang, a city of 6 million people to the east of Wuhan, has warned that the number of cases there is set to spike in the coming days, state media said. Up to 700,000 people had returned to the city from Wuhan before travel out of Wuhan was banned. Huanggang and the eastern city of Wenzhou have imposed draconian restrictions on residents, only allowing one designated person per family to leave home once every 2 days to buy food and other supplies, Chinese media reported. Hubei officials have extended the Lunar New Year holiday to 13 February and said that marriage registrations would be suspended in an effort to discourage public gatherings. Restrictions on movement will not stop the spread of the disease entirely, but will slow its progress and buy time for areas that have avoided infection to prepare. It will also limit the strain on health infrastructure by reducing the number of infections at any one time.